Thank you, Mr Deputy Speaker, and I beg to move that this House has considered the future of the NHS, its staffing and its funding. The NHS is a beloved national institution. Everyone in the country and in this House will have interacted with the NHS and have their own personal connections and stories that they can reflect on, from the birth of their children to the death of a loved one to seeing a GP about a health condition that they have. It's undeniable to most of us that the NHS is in crisis, and it's being pushed into an avoidable and unprecedented collapse after 13 years of Conservative mismanagement. All of our constituents will have been impacted by the crisis in some way, a crisis so bad that nurses took strike action for the first time in NHS history. Ambulance workers and other NHS staff have also taken action, and this week BMA junior doctors voted by a majority of 98% to take action. I want to thank all of my constituents who work in the NHS, and particularly those that got in touch about this debate, including paramedics from NIAS. On a daily basis, they are unable to hand over patients because of delays in A&E and lack of beds, and how frustrating it is that many of the calls are for people that need social care or can't get a GP appointment, rather than the acute calls that they are best placed to deal with. This really highlights the impact the crisis in social care is having on the NHS. Half of all people arriving in A&E by ambulance are over 65, and a third over 75. The lack of adequate social care for basic daily needs is storing up problems and leaving older people less able to care for themselves, or arriving in hospital with preventable health problems, adding to the pressures in A&E and bed provision. People that work in the NHS have had enough of being failed by this government's mismanagement. The country deserves better. When it comes to dentists, NHS dentistry is on its knees, with patients facing a growing crisis in access and resorting to DIY dentistry. The NHS was in crisis pre the pandemic, and the government's failures and mismanagement have made the situation far worse. For ministers to dismiss the crisis as winter pressures, or even flat out deny that there is a crisis, is frankly absurd. I will give way.
Just on the point of dental health, so it's not missed. The crisis in dental mental health is actually amongst our children at the moment. In some of our constituencies, that is directly as a result of the lack of provision locally, and we're feeding up a generation of problems as a result of this failure.
I thank my honourable friend for his intervention. I absolutely agree. The problems that we will see further down the line for our children are very worrying, and of course preventable with the right action is taken. The Conservatives blame everything from the weather to the pandemic, and even NHS staff, but it is 13 years of their failure that has left the health service in crisis. Yesterday at PMQs, the Prime Minister boasted about record sums into the NHS and spoke about a clear path to getting people the treatment they need in the time they need it. He's not living in the real world. Every briefing we received, every communication, spoke about delays in treatment and the devastating impact that has. They spoke about the decade of underfunding, and it's hard not to agree with the British Medical Association when they called the Prime Minister delusional. The last Labour government's allocated the NHS on average a 6% rise in the budget every year. Successive Conservative governments and coalition governments since have only allocated 1% a year. The Prime Minister can talk about record sums all he wants. He's fooling no one. The reality is that their settlement is not enough, and it is nowhere near what previous Labour governments invested. This crisis can be firmly laid at the government's door. There are so many awful headlines and statistics, and I will delve into some of them. But I wanted to say from the outset, we must all remember that when we talk about 7 million on waiting lists, when we talk about 500 avoidable deaths every week, We're talking about people. There are faces behind those statistics, faces of women who cannot get urgent gynecological treatment, faces of children who cannot access mental health support, faces of families whose loved ones have died, lives that could have and should have been saved, lives that would have been saved if this government cared about communities and invested in our NHS. When we talk about 133,000 NHS vacancies, we're talking about people that have left working for the NHS because they cannot cope financially or emotionally. We are talking about the rest of the workforce working harder to pick up the slack. We are talking about the NHS being unable to recruit because of the poor wages and conditions, and we are talking about the impact this has on patients. The only way to solve the NHS staffing crisis is by sorting out pay. The government yesterday agreed to negotiate with the RCN, and nursing strikes have been paused for those negotiations to happen. The government could have agreed to negotiations months ago, but they chose not to. Negotiations with the RCN alone will not solve the staffing crisis. Junior doctors have voted by 98% to go on strike, and the Health Secretary hasn't even offered a meeting. Negotiations with one section of the NHS workforce is not sufficient. All of the unions representing NHS staff need to be negotiated with. This government must make an offer on pay that is not linked to efficiency savings and productivity when NHS staff are already working unacceptably long shifts. An offer, as we saw on Tuesday, of 3.5% when inflation is at least treble that, and NHS workers' pay is worth less than it was a decade ago, is, as Sharon Graham of Unite the Union said, a sick joke. Christina McAnay of Unison announced further strike days next month. The government are failing to resolve this dispute, instead attempting to blame workers for putting patients in danger. Patients will never forget the Conservatives for refusing to negotiate and using patients as bargaining chips. This staffing crisis must be urgently addressed. The impact of waiting times on individuals can be severe and the consequences irreversible. 200 people in my constituency of Jarrow have Parkinson's. Parkinson's UK are concerned about people waiting longer than 2 years for a diagnosis. Similarly, the MS Society have said that there are over 13,000 people waiting more than a year for a neurology appointment. These delayed diagnoses and delayed treatments have a hugely detrimental impact on the individuals concerned. Delays in cancer diagnosis and treatment are life-threatening. For years, this government have missed cancer targets due to a lack of concerted action or matched funding. For South Tyneside and Sunderland NHS Trust, only 73% of people were treated within the target of 2 months after a cancer referral. Nationally, only 61% of people are treated within this target. The UK is being left behind, and people are dying when their deaths could have been avoided, prevented. That is why we need a workforce strategy, yes, to pay people properly, but also to enable the NHS to save people's lives. Labour have a workforce strategy. The government haven't even committed to fully funding their promised workforce plan. The Chancellor praised Labour's plan, so why doesn't he put his money where his mouth is and implement it? Labour will deliver a new 10-year plan for the NHS, including one of the biggest expansions of the NHS workforce in history.
On the workforce, what's your point?
I will be quiet.
I'm grateful to my honourable friend for giving way and congratulate her on securing this debate. This will come as a surprise to her, but I actually visited a private health provider in my constituency within the last fortnight, and they were telling me that they're recruiting people directly from university, people that are being trained at the cost of the state and then being used for private profit, and they're picking these people up, and it means that the health service, who can't afford to pay the wages they do, actually lose out. Has my honourable friend got some ideas on how that might be sorted?
I thank my honourable friend for his intervention, and it's something that I'm going to move on to now. This government's ideological commitment to the free market has led them to force through more and more privatisation of our National Health Service. Some government backbenchers are openly talking about moving on to an Americanised healthcare system where people are priced out of healthcare, even mentioning it in this chamber. We have seen corrupt contracts for cronies, friends of this government making millions whilst people suffer. This government have allowed the private sector to run rampant, taking hundreds of billions out of the NHS budget over the last 10 years. It is like this government are on a mission to destroy the NHS as we know it. They've even performed smash and grab raids on hospital repair budgets, taking 4.3 billion away, leaving hospitals falling apart, crumbling and leaking at the seams. 50% of trusts now have structural issues with leaks, collapsing floors, raw sewage and unsafe walls. The American news agency, CNN, last week said, Britain's NHS was once idolised. Now its worst ever crisis is fuelling a boom in private healthcare. The amount of people paying privately for operations is up by 34% in 2022. If this trend continues, it will embed a two-tier service in our NHS and price many people out of healthcare. My constituent Christine was referred to a private health company by her GP. My constituent Ray was told he could no longer get a service from the NHS and he would need to pay privately at a cost of £50. Ray said to me, I'm 74 years old and rely on my state pension. It makes it very difficult for me in the current economic climate to pay this amount. Having paid national insurance contributions for 50 years, I don't understand. Why do I have to pay again? And I look forward to receiving a response for my constituent, Ray, from the Minister. Of course, Ray is correct. As Nye Bevan said, no society can legitimately call itself civilised if a sick person is denied medical aid because of lack of means. As with any crisis, we see companies step in to exploit the situation and make money. I will give way.
I thank my honourable friend for making such a powerful speech and such a really important issue. Just on the point of private interest coming in, really fantastic GP surgery in my constituency, Waterloo Hub, is closing because the landlords are selling to a private developer. Many people have used that GP service for over many decades, and they are now worried about where they're going to register. The fact that a number of people across the country are waiting to register with NHS GPs, and there's waiting lists continuing to grow. Does she not see that that's another example of the private sector coming in and making it really difficult in our NHS system?
I thank my honourable friend for her intervention, and yes, I think we've all seen for ourselves, heard from our constituents how difficult it is to get an appointment, and certainly the private profiteers are driving that. And as with
honourable friend give way his point?
I will give way.
I'd like to congratulate my honourable friend for securing this important debate and making such a powerful case. Does she share my concern on the subject of privatisation? That in fact, and we've heard this in recent speeches in this chamber from Conservative backbench MPs, that it's entirely deliberate They're wanting to manufacture consent amongst the public for a move to an insurance-based American-style system by having more and more people feeling forced to take out health insurance or pay for it, so that over a number of years we see healthcare provision and the path of healthcare provision. See what happened to council houses in the past, where it went from mass provision to minority provision.
I thank my honourable friend for his intervention, and I absolutely agree that if things don't change, that is exactly the route that we're going in.
On that point, I too congratulate my honourable friend for securing this debate, but will she not acknowledge that this has already happened in dentistry, and now families are taking out dental plans because they cannot access an NHS dentist?
I thank my honourable friend for her intervention, and yes, we are seeing this across the whole of the NHS, and as she rightly says, including in dentistry. And as with any crisis, we see companies step in to exploit the situation and make money. US group Cleveland Clinic plans to open its third UK facility in London later this year, adding to the 184-bed hospital and 6-floor clinic it opened in 2021 and 2022 respectively. HCA Healthcare, another American group, which has over 30 facilities in London and Manchester, will be opening a £100 million private hospital in Birmingham later this year. 40% of private mental health companies need safety improvement, and we are handing over billions to companies that are failing our constituents. Too much of what is happening is hidden from Parliament and from the public. Where is the accountability of these private companies? Labour's plan for the NHS include working with partners to ensure patient safety and to bring down waiting lists. What they don't include is this rampant corrupt profiteering with contracts for cronies and profit put above patients that this government is presiding over. In England, we have a 20-year gap in life expectancy between the most and the least affluent areas of the country. Less than a year ago, the government promised to tackle the causes and symptoms of these underlying health inequalities, promising a white paper on health inequalities. Last month, the Minister's Department confirmed no white paper would be published. I'm pleased that today Labour announced that we will build an NHS fit for the future and cut health inequalities. The cost of living crisis has pushed over 2/3 of UK households into fuel poverty, which will exacerbate health inequalities that were already widened during the pandemic. In September, 1 in 4 households with children experience food insecurity, and in my constituency of Jarrow, 39% of children are living in food poverty. Malnutrition costs the NHS an estimated £19.6 billion each year. Investment in greater support, particularly targeted at the most vulnerable, would lead to returns in reduced NHS demand. As well as a strategy for the NHS, this government needs to start prioritising much more support to get the most vulnerable through the cost of living crisis. And I hope ministers listen closely to the contributions in this debate and take on board what is needed for a workforce strategy and funding to secure the future of our NHS.
The question is, as